You have it on your screen. Theme:
Yes, Father.
in defense of oxygen. For the next maybe 7 or 8 more talks, this is the theme: in defense of oxygen. Why? Because the ultimate target of infection is to stop oxygen in the body. So we are going to study oxygen, its vulnerability to infection, and how we can shield that. No? Um, so that will be the next conferences that will be coming up. The theme is in defense of oxygen. For today, uh, we have breathing tips for health. Last time we had 101 hydration, no? So the first necessary thing for the body to operate is water. Okay. And this time I am pointing out, as next to hydration, the importance of breathing, no? To maintain, to keep that oxygen in the body. So breathing supplies oxygen to trillions of cells. And how many trillions? Adult, it's about 15 trillions of cells we have to keep alive in our body. But if you talk about not adult, but the body size or by body weight, an estimate of 724 trillions of cells is possible. So you can see what responsibility we have to our body to provide and protect that oxygen that these cells need. Okay, so that's our target, our purpose for these talks. So normal breathing cycle. Uh, in the text we have there is 12 to 16 breath per minute. Now in 1 minute you have 60 seconds divided by 12. So every 5 seconds you have a cycle of inhaling and exhaling. No? So that's 12. When it is faster than that, uh, health gives 16 up to 25 are still okay. But 12 to 16 usually are the normal breathing cycles per minute. Per minute. And we have to do it to keep the brain alive and the trillions of cells. So we must know how to breathe and keep on breathing. Okay. So normal and abnormal breathing rates at rest. No, at rest is 60 divided by 12. That's every, no. So 12 breaths per minute, and up to 20, 25 is still acceptable. But go to the next. But when it is below 12 or above 25 breathing rate, something is wrong. And here I put a little note: asthma, anxiety, pneumonia, congestive heart failure, lung disease, use of narcotics, drug, and so on. So when there is abnormal rate of a breath per minute, something we have to look for a reason, I mean. So usually it's infection or other physical or psychological conditions. It will affect breathing. And when you affect breathing, you affect trillions of cells. So we must know how to take care really of that breathing. Infection affects breathing rate. No? So anything in the blood vessels that is not blood is infection or trouble. No? like free radicals. And on your left side there is an information, is the inflammatory mediators, and then mentions metabolic acidosis. On your right side, that's practically the knowledge that we have inferred or acquired. No? So metabolic acidosis, ano yan? When the body produces much acid, usually it is how it happens when the person is dehydrated. Lack of oxygen will raise the acids in the body. So that's one of the metabolic acidosis problem. When there is that problem, the brain comes into to rescue, sends a first aid. That's inflammation. Actually, inflammation, we have seen before, we had several talks about the inflammation, is good. It is the brain sending elements, nutrients, including red blood cells, to the affected area, where there is acid or any infected area, the brain, so like the healing of the wounds, that's the second stage, inflammation. That means the brain is sending aid, sending help to begin healing. So in itself, inflammation is a good sign, but you will have to support it. Otherwise, something can be detrimental to health. Then when inflammation comes in, it means less oxygen in the body. And this is the reason for the rise of inflammatory or a rise in respiratory rate. I put there small capital letters, hydrate please. When you lack oxygen, the first thing to get is a glass of water. Okay, so look at the process, the events. Metabolic acidosis. Something is happening in the body that causes acid rise. Then the brain comes to the aid. Inflammation. The brain sends nutrients or help. That's first aid because of the loss or lack of oxygen. Okay. So what do we breathe for? Wow. Okay. Number one, basic supplies to supply oxygen to trillions of cells. Now we have seen that. Second is environmental influence equals stress of all kinds. To make it short, all kinds of stress. Now whether it is good or not good stress. There are good stresses, like when you are practicing piano or performing arts. No, you are stressed, but it's good stress. Okay. Number three, to function, to work, to recreate. Yan, we have to breathe in order we are to be able to work or to function or render service to people or also to recreate ourselves. We have to know how to breathe, to recreate ourselves. Okay, so how to breathe? Breathing to relax. You see the number 4, 7, 8. So inhale, hold, exhale. That 4, 7, 8 are seconds. So you inhale in 4 counts or more or less 4 seconds. Hold the breath for 7 seconds. If you cannot do it gradually. And then release it slowly for 8 counts. So you might instead of seconds, you might do it count. So inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, exhale, 1, 2, 3, 4, 5, 6, 7, 8. Like that. So you inhale. So this is a slow, deep breathing. And you know what is the byproduct or the good thing about it? If you makes you sleep quickly. If you practice this one, it helps you to sleep very fast. So inhale in 4 counts or 4 seconds, hold as long as you can, and then release it 8 in 8 counts. So this is breathing for anxiety, to relax, to counter anxiety. And these days, we are all stressed by the pandemic situation. So I think we need how to breathe to relax. It's the same, but there are two things I want to insert here. The 8, on the 8 there is pursed lips. How to breathe, how to release that breathe. No, it's like whistling. Pursed lips, you put a very narrow hole on your lips and blow it there. In the description there on your left side, it says making a whoosh sound. So you close your mouth and blow it. Whoosh. Hinihipan mo. Ganon. You blow it. Like whistling. Whistling is a good example of pursed lips. Then on that variation, there is down there 2 to 7. That's the hold. No? Actually, you can hold as long as swimmers, singers, they hold their breath longer than that. Okay. But this is for a particular purpose we are having, no? How to breathe to relax. Okay, so 4, 7, 8. Still 4, 7, 8. Yeah, he closes his eyes. Actually, the other trick here is you watch your breath. No? So you close your eyes, your mind open, and just follow your breathing. You sleep very quickly. This is the reason for this picture here. No? Okay. And what is the advantage of that holding your breath? It rests the heart. No? It gives time for the heart to stop pumping for a while, and so your diastolic your heart has time to rest. That is one factor of relaxing. Holding your breath, actually decreases the blood pressure. Okay, I have some note on that afterwards. So holding the breath, the important thing of that holding the breath is rest the heart, allows you to rest the heart, to make the heart stop for a while. Not exactly stop. Okay, this is another technique for those who have high pressure job like policemen, or soldiers. How to focus. People with high stress jobs, okay, or in fight or flight mode, or to, even if you are working, you want to concentrate on your work, you can pause for a while and do that breathing exercise. This time is 4, 4, 4. 4 inhale, 4 counts for hold, and 4 to exhale, and repeat. So that kind of rhythm in order to keep the brain alert. Okay. Other breathing practices, in the internet you'll find plenty. This one is for children, no? So no age limit to train to breathe. I put it there. Okay. So the lazy eight. No? So one part of the eight is inhale, the other part of the eight is exhale. No? So there is the triangle, inhale, hold, exhale. The same with the star practically. Anyway, there are methods that uh, can help relax the brain, the heart, the muscles, the body. This is a particular breathing exercise, belly breathing. Many singers are using this, although not all. No, some of them are also brush. But just to tell you that there is also this kind of technique to hold the air in your body, so you have enough to sing the finale also. Okay. Now, chest and abdominal breathing. Now, I put there a body of a swimmer on your right side. Usually, the swimmers, all swimmers, malaking kaha nila, no? They have very big chest. Because when you hold your breath, your lungs expand. And in that process, the lung capacity expand when you hold your breath. No? So in sports, weightlifting, something like that, swimming, even singing, they are really trained to hold their breath so that they can perform. Okay. This is a trivia. Also, the whale is breathing like that. No? And the whales are not fish. They do not breathe. They cannot. They breathe like us. So they have to go to the surface to get the air. So this is just a trivia that uh, even though the whales, they are very big creatures in the sea, and they breathe like us. Okay, that's still explaining the whale. All right. Posture may unconsciously affect breathing. Ayan. So sa internet you'll find plenty how to sit down, no, how to stand, how to walk, no. But yung kuba affects the lungs and therefore breathing, and therefore trillions of cells are suffering. So you see how important it is for us to know how to breathe, to take care of our posture. It is not just to show off, but really to be able to breathe properly and render that service to trillions of cells that need that oxygen. Okay. Okay. Significance of holding the breath. If you are taking your own blood pressure, you can make this experiment. First, take your blood pressure the way it is done ordinarily, no? So how you do it, okay, and note the result. Then, switch off the machine, take a deep breath, switch on the BP monitor as you hold your breath. Now, so when you put on the machine, you also inhale and hold your breath until the machine reports the result. I tell you, the result is very different. It's much lower. That's why I mentioned kanina, when you hold your breath, the heart is able to relax a bit, to rest a bit. No? So the result is much lower than number 2, no, or the result that you have seen. So the heart is able to rest. And even if for swimmers, they hold their breath, and sometimes for a number of minutes, really, to reach the end of the pool. No? Yeah. But the effect, the effect is that they build their lungs, no? the capacity of the lungs to hold air, so that they can work longer without having to breathe. Okay, so more or less that is about the breathing. In defense of oxygen, this next slides, I am going to review some of the things that we took last time. Uh, because of the emphasis or the plan I have to show that alkaline, or there is really a possibility to shield, to protect the oxygen, the red blood cells from infection. And I'm basing it on acid-base chemistry, acid-base balancing. So we'll review that information. So I am not depending on authority. I'm depending on science. Okay. All right. So this is one of the first knowledge we get. No? That the RBC, the red blood cells, the red blood cell is naturally negatively, knowledge 1, column on the right. RBC is naturally negatively charged to allow them to flow, to move, repelling each other, so they don't stick to each other. That is natural design, because they have to bring oxygen and they cannot stick together, otherwise they cannot bring enough oxygen. So that's a given. April 1, I was able to find that this information from X Zhang, no? That he published that the coronavirus is positively charged. Now, knowledge number 2. The law of electricity, the theory of electron theory, or the law of electricity now gives this: opposite charges attract. That means negative to positive. When you connect your negative to positive, that's a short circuit. Now, when there is nothing in between, you get a very big clap noise of short circuit. No? So they attract each other. But like charges repel. So negative to negative, they will not stick to each other. No? Kahit anong palo mo dyan, di yan didikit. Or positive to positive, no? Well, they will not stick to each other. They will repel each other. These are very important information about cells and how to defend the cells. And knowledge number 2. So this is the reason why when the positively charged coronavirus enters the lungs or the blood vessels, it will hunt, it will attract the red blood cells because they are negatively charged. And this is the reason for the coagulation. And this is what we are working, how to defend the red blood cells, no, which are negatively charged against the infection or any acid thing coming in. Acid is positively charged. Infection usually. So how to defend? No. So on the left lower corner, no, there is a yellow highlight there. It's plus OH negative equals water. This is the acid-base balancing. This is the acid-base chemistry. This is natural law. This is law of nature. We cannot contest this. And so if we follow this, we get the healing. We get oxygen. Okay. So on the right side, action is really to build a shield. How to shield now the RBC, the red blood cells. Now we have already shown that in some conference, and this is the object of our topic. No? How to shield, how to protect that RBC against any infection coming in. So this is a kind of explanation why essence or the enzyme, no, or baking soda or boiled water for that matter. Now we have seen that before in the last conference. They have potentials to stand against infection. Why? No. So acid-base principle, that is OH plus, okay, that there equals water. So acid plus alkaline equals water. This is natural law. This is a saving factor, no, when we work on our red blood cells. Okay. So infection deprives the blood vessels of oxygen. Kasi pinadikit-dikit ng positive charge yung negative, no? Ina-attract niya. So hinuhuli niya, dikit-dikit sila. Red blood cells cannot bring oxygen anymore. That's why kinakapos ka ng hininga. But an alkaline solution, OH negative, present in the arteries or in the blood vessels will hunt the acid, the H positive, the lower line, or free radicals, infections. And since oxygen is embedded in its molecule, as it hunts, it also provides oxygen. So this is good material to shield the red blood cells from any infection. And we are working on this principle. So how to defend and how to deliver the defense? Nandyan, drink, nebulize, oxygen tank, or topical application. No? In the topical application, I have introduced the olive oil with essence. Why olive oil? Because olive oil is unsaturated fats. That means kahit anong lamig ng panahon, hindi siya tumitigas, hindi siya natutulog. Kaya it will not block anything in your body. Okay. So I put these two pictures. No? The complication of the oxygen tank and the cost it has to be able to breathe versus a simple nebulizer. They have almost the same function. The only thing with the oxygen tank, it can run 24 hours until it is consumed. But the nebulizing machine, if it is not heavy duty, you have to stop every 15-20 minutes to make your compressor rest. No? That's the only thing there. But in terms of help to breathing, no? They are the same. And in nebulizing, no? You can also put inside the enzyme or the essence on the cup. Kung sa oxygen, pwede din doon sa humidifier, no? But usually, if it is in the hospital, you cannot tamper it. You cannot do it. If it is at home, you can also put drops of essence or alkaline on that humidifier, if you like. It will work like the essence or the enzyme. Okay? So aside from the oxygen or the nebulizing, there is also steaming with rock salts or even with essence. Steaming is suob or tuob in Ilonggo or suob in Tagalog in Filipino. No? And the only thing is you are dealing with steam, very hot water, so extra care, very careful. And you have to have a very wide base. So a bowl or a basin na hindi siya matapon. No, kasi mainit yan talaga, kumukulo yan. No? So very stable, and the steam, you breathe, you inhale. Okay. That's how to do suob or it's safe enough, except that you are dealing with a very hot material. The simplest, yet the simplest is just a glass of water. No? Alkaline, a glass of water. You sip every 15 minutes if you like. No? That's your dextrose, how you supply oxygen, or you drink it in the regular hours. No? To be sure that you supply oxygen to the cells, especially when you have some ailments in the heart or in the lungs. I really suggest that every 15-20 minutes you sip, and not drink, sip, supply oxygen to your body. Just imagine, I was telling you earlier, you have trillions of cells to feed, to give drink, to give oxygen. And that glass of water may not be enough. No? Okay. So I end the presentation here. No? Do not lose your peace. Help is very near. Pray and have water. I think it is a good, no? Do not lose your peace. Because oxygen, the target of the infection is to stop oxygen. So you do not stop providing oxygen to your body. Drink water. Drink, drink, drink. Okay. All right. If you like, I can also present before we ask question. No, I will show how to use the nebulizer. No, Father Ramil again on the rescue. Sige, I will show it to you. I think this is the one. Yes, this is Father Ramil.
On this video, I will be showing to you how to nebulize. So ito yung nebulizer, ito yung mask ng pag-nebulize. So ano ang ginagamit kapag nag-nebulize? So we use this essence. So this is an immune booster. And of course, we also use this distilled water. So kahit naman anong brand, okay lang siya. So ano po ang gagawin natin? So we put at least 5 ml or 1 teaspoon of distilled water on this. Then after putting the 5 ml, so we put the essence, the immune booster, at least 3 drops. 1, 2, and 3. Then kapag nailak na yung mask natin, so we wear it, so isusot natin, and then we just turn on the nebulizer. And then inhale both through the nose and the mouth. So you can do this for 7 to 10 minutes per session. So that's it, no? So that is supposed to be for 7 to 10 minutes. So why do we have to nebulize? So first, remember that it avoids coagulations of the blood. It neutralizes any free radicals because of the pollution, for example, the nicotine, no? Nililinis niya. Anything that is harmful to the body, nebulizing would help. And then it disinfects the blood vessels, and at the same time, it ensures the delivery of oxygen in the lungs. So simula nung nagkaroon ng pandemya, so gumagamit na ako ng nebulizer, and of course using the enzyme or this essence immune booster with the distilled water. So hopefully this video would help you, and it would encourage you to use the nebulizer or do the nebulizing.
So that cup, no, that's where you put your distilled water, or if it is not available, you just use bottled water. The 5 ml is estimate. No, you might not use them all. So if you keep it closed, you can still use it after a while, no, to continue. You might add just 1 drop. Okay. And yeah, you can alternate breathing through the mouth or breathing through the nose. So you inhale through the nose 1 time. At another time, you can also inhale through the mouth and release through the nose, no? Or inhale through the nose and release through the mouth. By the way, the mist that is there is not harmful to the eyes. In fact, I have a solution that, the ratio that you can also spray directly to the eyes, the essence, no? Just more or less on that glass of water that you drink with 3 drops, it is very safe to spray it even directly to the eyes, no? When it is very itchy or something like that. Okay, let me see if there is something else. Yeah, so some are not yet familiar with the nebulizing. That's the mask, no? No, that's the mask. Okay. Anyway, and stop sharing. This, okay. We can entertain some question about breathing. I hope I delivered the message. Breathe to relax, breathe to concentrate, but breathe especially to provide oxygen to trillions of cells in your body. No? Yeah. So the technique of breathing is available in the internet. There are many techniques how to relax. No, I just took that 4, 7, 8 because it can also help you go to sleep. Okay. Now we can entertain some questions.
Father, question po.
Yes, please.
Father, yung hikab ba malaking tulong din?
Sa hika,
Hikab. Hikab.
when
Kasi
you,
nakakapag- Yes.
yeah. Usually you release a block of acid, no? There are many tricks. In some cases, they're even imitating the lion, the way the lion relaxes. But I did not go to that extent anymore. But in a way that you disturb or stop the rhythm of anxiety or of no, rapid breathing, hapo, no? When you are beyond 25 breath per minute, there is something wrong. So you must learn how to hold your breath or how to, no? And hiccup, ang sinasabi mo, I think if I understood it well, it is how do you call this? Tig-ab sa Ilonggo siguro. Yeah. Yeah, you release a lot of air all of a sudden, something like that, no? Yeah, that is, I think that is similar to the lion way of relaxing, no? It's also being taught in the internet.
Okay.
Yes. Yeah, it will help. Basta you release that or you stop the rhythm, the abnormal rhythm of more than 25 breaths per minute or lower than that, you have to break that and to force yourself to go within the normal rate. No? All purpose is to provide oxygen. Rapid breathing, more than 25 per, it's giving trouble to the heart. Yung hapo. No? The heart cannot rest or something like that. Yes. Any more?
One more question, Father.
Yes, please.
Regarding sa nebulizer, may nauuso po kasi ngayon, since nung itong medyo mataas yung infection, nagkakaubusan daw ng oxygen. So may nausong machine na binibili yung tawag nila oxygen concentrator.
Oh, very expensive.
Nakakita na ba kayo? So meron din po siyang tubig, Father, na nilalagay kasi
Yes.
may ano din siya parang dual purpose din siya as nebulizer din siya
Yes, the oxygen, because oxygen is actually air, no? And it's not easy to bring air into the lungs. And usually, that's why the humidifier produces mist. And the mist, that's where the oxygen is being carried into the lungs. Yeah. So oxygen tank or even the oxygen concentrators, they have humidifiers to allow the mist, no, to come out and breathe and inhale. Yes. Yeah. Okay. That's a good information. Only that it's very expensive. Yeah,
And
oxygen.
one more thing, Father.
Yes, please.
Nakabili po ako ng very handy na tawag dito na
Nebulizer.
nebulizer. So, sharing ko lang na just in case dun sa mga taong dito sa webinar natin, pagka outside sila, nagtatrabaho, biglang sinamaan sila ng pakiramdam. So, magandang may bit-bit po sila nito. Papakita ko sa internet.
Portable, yeah.
So, tsaka
Because-
napaka-quiet, napaka-low decibel po siya.
Okay.
Papaanda rin ko, Father,
Okay, sige.
Ito po, nakikita niyo yung usok.
Yeah.
Nakikita niyo po yung usok.
Yes,
Tsaka
yes.
naririnig niyo, may naririnig kayong sound. Kasi wala siyang sound.
Okay.
So, they can use it in their office o kaya kahit nasa sasakyan sila para yung
Yeah.
ano nila, yung
Yeah, emergency, yeah.
yes, pwede anywhere. So,
Okay.
yun lang, Father, yung sharing ko.
Yeah, okay. Thank you.
Ma'am, magkano po yung ganyan, ma'am?
Ma'am, sa Shopee po, nakakabili from 500 to 1,000. Ang hindi ko lang sure yung quality
okay po.
na kung gaano siya katagal. Pero ginagamit ko siya gabi-gabi.
Yeah. Yes.
Ano po siya, pwede po siyang battery AA yata. O meron din siyang pwedeng i-connect sa kuryente.
Okay. Very good. Thank you, Joe. Yes. Actually, the official thing is oxygen tank, but not maybe everybody will be able to provide that oxygen tank and carry it around. Yeah. So these are portable things that you can never tell when the attack comes to you. No? So it's good to have something ready. Okay. More.
Tanong po ako.
Yes, please go ahead.
Pag nag-nebulize po ba, normal breathing ho ba?
Okay. Okay. Very good question. Very good question. Inhale. No. I suggest you inhale and fill up the lungs. And then, so that you don't, you release slowly. Otherwise, kung inhale and exhale very fast, hapo din ang labas. Not good. So, even in nebulizing,
Pwede na po bang i-apply yung...
yung 4, 7, 8,
I-apply yung 4, 7, 8.
yes, you can. Yeah, you can. You can. The 4, when you count 4, like the swimmers, they just open their mouth for a short second to inhale and fill up the lungs. No, so that's the technique. I call it slow, deep breathing. In the office, the same. Slow, deep breathing. In fact, even those who might be experiencing sometimes some chest pain, no, try to simulate coughing, something like that, no, to disturb to get out of the rhythm of the malfunction, no. Yeah. Okay. Any more? You're welcome. So on this, the important thing for this evening is how to breathe, and I think we have to really take that duty of breathing, na, and knowing how to breathe, because we are supplying oxygen to trillions of cells. We have a very big duty to supply that, and we must know how to do it. Unless sick, unless we are like asthma or other infection, no, like pneumonia. It's very hard to breathe, no, something like that. Okay, go ahead.
Father,
Yes, please.
yung matagal na po na essence, may expiry po ba yun?
No, practically it has no, this is, if there are sediments, you can take a filter paper or just allow it to settle and then you pour and, no problem. You can use it.
Even 4 years na, Father?
Yeah. I have,
Okay.
I have here in my room very old ones already.
Okay. Thank you so much,
Yeah.
Father.
Kung may sediments kasi ano yan eh. The process that is extracted from banana sap, from banana tree. So you will have fibers. It is possible to get some fibers after a long time. Now they settle down. No problem.
Oh, Father, thank you so much.
May natira ka pa sa dati mo. Okay.
Yung matagal na, oo. Okay,
Yeah.
Father, thank you.
Yeah, I saw the name. I remember the name. Thank you. Yes, please. Anybody? Okay.
Hi, Father.
Hi. Yes.
Comment lang po, Father.
Yes, please.
Minention nyo before lack of oxygen means dehydrated din po yung
It
katawan.
is-
Naalala ko lang po.
Yeah, it is possible that one of the causes.
Okay. So, yun lang, Father.
Yeah. In fact, any sign of acidity, any sign of GERD or acidity or something like that, first thing is not medicine. The first thing is water. Because acidity means lack of oxygen. And lack of oxygen can be triggered by dehydration is the most common. Because the moment we are into our work or busy with our work, we forget to drink. Or remember, we have to remember this: stress, thinking, or manual work, or any stress dehydrates. It consumes oxygen. So the first thing that you have to get out of your stress is water, oxygen. Oxygen. So even in this symptoms of the coronavirus, no, the LBM, it's acid, plenty of acid in the stomach. No, the coughing, your lungs is drying up. That's why it triggers you to cough. So sip water, sip, because if you drink too much, it might be bloated, so like that. But just sip, and to sip your water, it's even good because the absorption is gradual. Okay.
Father.
So any symptom that you feel, that you recognize from this current threat of coronavirus is threat to oxygen. And the first source of oxygen is water. No? And the best thing still is boiled water or alkaline water, because it has the negative electrical energy to stop even the positively charged virus or infection.
Father,
Yes, please.
when you say boiled water, that's hot water.
Yes. Boiled water, okay.
It doesn't have to be boiling. It can be.
No. It has to be.
Can
Okay,
we
I
use,
will repeat.
Father, we use the air pot?
The air pot, I do not know what's the temperature it has.
But it's hot.
Yeah, but usually boiling point is 100 degrees. So it has the water for its pH to rise. It has to be boiled at least about 10 minutes from the boiling point.
Okay.
It's not just enough to warm it. No?
Okay.
The theory there is for the electrons to move that fast so that it generates that electromagnetic field and maintain that energy.
Okay. Thank you.
Somebody engineer here before on the Meralco. I mean, somebody here, I think, is one.
Father,
Yes,
one
please.
more.
Yes.
Okay. When you inhale through the nose and then exhale through the mouth. Can it be the other way around?
Yes.
You inhale through your mouth, exhale
Yes.
through the nose.
When
It can-
nebulizing, yes. You can
but-
alternate.
I see. But when you don't nebulize, you inhale through your nose.
Yes.
But when
Better.
you nebulize, you inhale through the mouth.
Both can be done.
Either way.
Yeah. The
Okay.
important thing of inhaling through the mouth is you also the throat can be
Okay.
cleansed.
Okay.
Or when you inhale through the nose, also your sinuses are disinfected.
Okay. So Father, we can alternate.
Yes.
Thank you. Thank you.
Father, good
So-
afternoon. Na-late ako.
Yeah, okay lang.
Nakatulog.
Tigas pa rin. Oh, yun na kwento siya.
The important thing of today is how to breathe, to relax. No, that is inhale in 4 counts or 4 seconds. Hold your breath for 7 seconds or 7 counts, and release in 8 counts. When you master that, you can also prolong hold and release. Not like the swimmers. That's why yung kaha nila, they have very big chest, because when you hold, inhale, fill up the lungs and you hold it, you increase the capacity of the lungs to hold air, which is good. And that means you have a strong oxygen supply. Okay.
Father, ano ngayon? Inhale is 7 counts. Exhale.
No, inhale. Inhale in 4 counts. 4, 7, 8. 4 inhale,
Mhm.
7 hold,
Mhm.
8 release, exhale. That
Okay.
is
Thank you.
breathing to relax. Breathing for how to concentrate, or this they said high risk, high pressure job or something like that, is simpler. 4, 4, 4. 4 inhale, 4 hold, 4 release, and repeat. No? So I give only those 2. One to relax and also to help you to sleep. That is the 4, 7, 8. No? And the other one is how to concentrate or centering. They call it also centering. No, like the job of the police or soldiers or high pressure job. 4, 4, 4. Yeah.
Sige. Thank you, Father.
Yeah. So our webinars in this next about 2 months, I think, is how to defend, how to protect oxygen. because that's the target of any infection, of any, or even the coronavirus. They want to stop oxygen. And that means the target is our red blood cells. So we have to know the characteristic properties of red blood cells and the pH and the other kind of properties of the red blood cells to be able to balance it with the acid-base balancing or acid-base chemistry. That's the principle we are working on. How to protect, how to shield the red blood cells from any positive charge entering the blood vessels. I hope I will be able to deliver it well. But I have already some materials. Okay. Some more questions, if there are.
Father?
Yes, please.
Father, paano pong management if in case kunyari COVID positive po? Paano pong gagawin pag sa nebulize?
Okay. Okay. If they have a nebulizer, no, I would recommend even every hour. But every time they have some difficulties of breathing, I would say nebulize. No? Kasi ibig sabihin, mayroong pumasok na trying to block the oxygen. So you need alkaline, you need the OH negative hydroxides. No? That means a molecule with negative electrical charge and at the same time oxygen. Ang alkaline lang mayroon yan. That's why it is a good shield. No? And that is our experience on the last since 2005. Na iba-ibang sakit, iba-ibang cancer, isa lang ang binibigay, oxygen. So how to deliver that oxygen is very critical. Kaya when there are symptoms of COVID like LBM, they have mentioned that already, no? Then another one is masakit yung likod, no? Then yung isa is ubo. Ubo is really, that means your lungs is drying up and you have to moist it, you have to give it water. Cough is triggered by lack of oxygen. And so to counter or to deliver oxygen, you drink water. That's the easiest. Or nebulize or oxygen tank, no? Or nebulize. Basta don't persist on your cough. Do something. Drink water, sip water, introduce oxygen to the body. That's the easiest thing. When you have nothing, no? That's why in the last conference I said, you boil water, no, and put that in the thermos. No, kahit malamig na yan, basta na-boil mo na yan for more than 10 minutes, mataas ang pH niyan. So, we are working on high pH therapy of A.K. Brewer. It's not mine. A.K. Brewer, no, high pH therapy. And his pH was only 8. pH 8. pH 8 is also, the essence is 9. The baking soda is pH 8. So there are materials that could deliver oxygen. We just have to know how to use them. Okay.
Thank you, Father.
Okay. Are there questions in the chat box? I cannot attend to it. B-Boy?
Wala po, Father. Yung question lang po kanina yung sa nasagot na po ninyo, Father.
Okay.
Father,
Yes.
nung last week, yung last na natin, nakinig po ako sa inyo. Yung
Yes.
sabi niyo, pag may cancer, 8 drops a glass yung pinapainom ho ninyo. Kasi ho nung Lunes o Martes, sumama yung pakiramdam ko, ang sama ho. Tapos 5 beses akong pumasok sa CR.
Yeah.
Natakot ako kasi parang na siya talaga, parang tubig na. Ang ginawa ko ho, naalala ko yung sinabi ho nyo, nagpakulo ako ng tubig, nilagyan ko ng 8 drops, 2 beses ko ininom, talagang awan, salamat sa Diyos, nawala, talagang umukay ho
Okay.
yung pakiramdam ko.
That's high pH. That's
Oho.
correct.
Salamat, Father. Buti ho nakinig ako sa inyo last Saturday, Father.
The high pH means electrical charge, no, and oxygen, presence of oxygen, and that negative electrical charge. That negative electrical charge is the hunter of cancer cells or infections,
Opo.
no, or acid. Kaya LBM is acid.
Opo.
Kaya boiled water, mataas ang pH, no,
Opo.
can address exactly that. That's what you are saying, correct?
Opo. Thank you po, Father.
Oh, thank you also for the courage to share it for everybody.
Opo. Kaya nga ho, nagpasalamat ako sa Diyos ho at nakilala ko kayo, Father. Ilang
Okay
years
lang.
na ho, bumibili ako sa inyo. Pati sabon ho.
Ay, okay lang.
Kahit ho yung mga sabon.
Father,
Hello?
very thankful kami sa inyo, Father.
Okay lang, thank you. Okay. We will work together. No, this is crisis time. And we have to share our knowledge for people to live.
Father, kahit na ho yung sabon,
Yung sabon is okay, if this is the first time around you are around, the previous webinars I have already talked about it. Maybe we'll talk another time, especially for breast cysts, breast lumps, breast cysts, no, the soap has a lot of countering. Even lumps, the hard lumps, they become water. And special application lang. Yung ang ano yun is, okay, I can say it now. After you use the soap to take your shower, clean. Then after you have already you are clean, no?
opo.
Haplasan mo ulit ng sabon. Iaan mo lang yung your palm on the soap. Haplas mo siya doon. Then ihaplas mo siya sa breast before you put the bra. Huwag mo na siyang banlawan.
Opo.
That means you have a thin layer of soap on the breast. Then you put the bra. That
Opo.
means when you perspire, under the bra you perspire. When you perspire, that perspiration is acid.
Opo.
But with the presence of that soap, which is alkaline, that acid is neutralized. So kahit na ma-absorb siya ng under the in fact, it can become a healing tool to remove the other cyst under or beneath. Kasi ang ina-absorb mo tubig, hindi na acid. Now we had multi-cyst situation sa breast, na-address niyan.
Father?
Yes.
Father, sa...
Go ahead, Miss Lim.
Father, sa totoo lang ho, marami ko na napatunayan, yung ari ko po, Father, yung sa left na pisngi, may tumubuhong maliit na bukol. Ang ginagawa ko ho, pagkatligo ko, binabasa ako ng konti yung daliri ko, tapos nilalagyan, parang ginagawa ko siyang ointment.
Yeah, yeah.
Hawak, tapos, Father, nawawala talaga doon.
Yes.
Yes. Ako gano'n, nawawala
Yes.
talaga yung bukol. Totoo,
Yes, yes.
Father.
Yes. That's
Sinasabi
correct.
ko, mga kapatid ko, yung kapatid ko na isa, kasi tatlo kami magkakapatid, gumagamit to kami ng ano niya, sabon, saka enzyme, lagi, ilang years na, ang tagal na ho. Siya rin daw,
Okay,
ganun din experience niya.
Okay, yes, it's true. It's true. Even for wounds,
Opo.
even in
Ginagamit ko po.
one of the seminars I already I have shown yung third degree burns na sabon lang ang ginamit. She had no pain, and in less than a month, she was already healing.
Opo.
The most important thing is she was not experiencing hapdi.
Opo.
That's oxygen doing the job.
Opo.
Okay. Okay, please.
Yes, good evening, Father
Okay.
Carmona.
Yes.
It's my first time to attend this
Seminar.
Zoom seminar.
Okay.
But then I was your client since 2009. Since
Okay.
sa Don Bosco. Anyway, ang question ko, kasi dati, di ba, hindi siya pinapatak sa mainit. So, nang narinig ko kanina nagsalita kanina, na pwede pala ipatak sa mainit yung 8 drops. Pwede bang
Yes.
gawin yan everyday?
Yes.
As my protection?
In fact, it is most efficient in hot water, and it is working also
Okay.
on a steam. You can drop.
Okay.
You can put the essence or the enzyme in steam. Yan, pag nagsuob kayo, you can do it.
Okay.
It is most efficient in that state.
Okay. So, normal po yung 8 drops.
Yeah,
Na
that's
ipapatak
already a little what is it. Pero very safe pa yan. Sa yung 8
Okay.
drops na yan. That 8
yeah,
drops.
okay.
Yeah. We're still very safe in terms of the percentage that you put in that amount of water, or 200 ml.
Actually, Father, kasi we have our monthly swab test in our office. So, meron akong rhinitis. So, yung nagpapatak lang ako ng 3 drops lang sa water, ni-spray ko sa ilong ko. Kasi pag sinaswab, sa ilong tsaka sa bibig.
Yeah,
Tapos alkaline. Sa awa ng Diyos naman, I've been negative since last year May sa monthly swab test namin.
It
Kasi
is true.
takot. Dahil sa
It
rhinitis, di ba sabi pag may sipon, baka pwedeng mag-positive. Pero so far, wala. Dahil dito
It
sa
is,
alkaline na ini-spray ko.
It is true. That's why I am recommending nebulizing or suob
Yeah,
with the essence on your water. It is most efficient when it is on steam.
Okay. Thanks Father. At least nalaman ko kasi dati sa normal water lang pinapatak. Ngayon okay.
Yeah.
Okay.
Yeah.
Okay. Thank you, Father.
Yeah, that was I used to hindi yun kasi steam is really very risky if you don't know how to handle it. You burn yourself.
Actually, I'm having every time galing ako sa office before and after talaga lagi ako nagsusuob.
Yes, it helps. Or nebulize or suob. Very few seconds lang yan kasi the coronavirus is susceptible to heat.
Yeah, okay.
So, yeah, very good. Thank
Okay,
you
thanks,
for the
Father.
sharing.
Yeah, thank you, Father. Thank you also.
Yeah.
Excuse me, Father.
Yes, please.
Father,
Ronald.
pwede po ba ako magtanong kay Nanay? Nay, yung bigla na lang na nagtae siya, na lumabas na yung symptoms ng cancer, Nay, halimbawa, hindi niyo naisip yung yung advice ni Father Carmona, ano po yung gagawin niyo? Thank
Alin
you, Nay
ho?
Francisca.
Paulit ho?
Halimbawa lang po, hindi kayo
Opo.
nakakakinig sa kanya last week. Ano po ang gagawin yung medication?
Hindi, kasi ako talaga, may naka-ready na talaga ako isang lagay ng tubig na yung 1,000 ml, saka isang thermos na hot water. Lagi kong pinapatakan talaga ng enzyme, yung essence. Kaya yun talaga ang iniinom ko. Pero nung nangyari sa akin yun, tamang-tama, naalala ko yung sinabi ni Father kasi pag cancer, grabe na yung sakit na yun, di ba? Yung pakiramdam ko nung talagang ang sama ng pakiramdam ko, natakot ako kasi mag-isa ako eh. Naalala ko yung sinabi ni Father na 8 drops, kaya ako ginawa. Pero hindi ko ginagawa yon kasi sinusunod ko yung pag-ordinary na tubig lang. Kunyari, lalagyan ng, di ba, 200 ml, 3 drops. Yun lang ang ginagawa ko lagi. Pero everyday talaga umiinom ako dyan. Ang tubig ko talagang may enzyme lagi, may essence. Yun lang ginawa ko kasi nga nag-iba pakiramdam ko. Saka 5 beses akong pumasok ng CR. Talaga ang takot ko. Pinakahuli, talagang tubig na yung lumalabas. Talagang salamat sa Diyos talaga. Kaya sabi ko, ginagabayan talaga ng Diyos si Father eh.
Father, did her alkaline went up to 9 and 10?
The 8 drops means your pH goes something like 10.
Okay.
It's not just 8. No. Usually the 3 to 5 drops gives you pH 8, 9. The 8 drops will give you something like 10 pH.
Thank you, Nanay. God bless po.
Opo.
Okay, very good.
Father, there are
Yes,
questions in the chat box.
Okay, please.
A comment from Joanne Riosa, Father.
Yes.
90% olive oil. This was the question. She was answering the question prior to this, Father. 90% olive oil. Virgin has 10% essence. Blend it in blender, pero in time po maghihiwalay pa rin. Shake nyo lang pag gagamit.
Okay. Oo.
Tapos question from Fresi Duque. Father, what is the ratio of baking soda to a liter of water?
1 teaspoon. 1 teaspoonful. 1 liter. It will give you pH 8.
Yeah, thank you, Father.
Okay, you're welcome. Yeah. 1 teaspoon. Kahit punong-puno, okay lang. 1 teaspoonful to 1 liter. That will give you pH 8.
Father, if we add additional na sa baking soda, Father, does it increase yung pH po niya?
No, the same pH 8 pa rin siya. Ang baking soda is pH 8 lang siya talaga. Pero it's enough. It's good pH already. Very good pH. To counter LBM, to counter acid, it's good.
Okay, Father.
Yes, okay. Yes, please, Liz. You are naka-silent ka. Naka-off yung mic mo, Liz.
Yes,
Okay.
Father. Father, meron bang nagbebenta ng alkaline sa UAE? Kasi yung mga, I have
Wala yata. Wala yata.
kasi may mga
Mayroong, I have one patient there before. Pinapadala niya lang doon.
Okay, thanks, Father.
That was yung breast cancer din yun eh. Okay, anyway. Yeah. Some more questions. Yeah. Anyway, I'll I'll say my number in case you have some follow-up questions during the week. I suggest you text first and then identify Kasi kung minsan pag diretso tawag, hindi ko sinasagot. You text and introduce your name. 0922 845 2892. 0922 845 2892. Okay. Yeah. Somebody tried it. Okay. Yeah,
Father,
you can put it in, somebody put it in the chat box. Okay. Yes.
Father, do you still accept yung pagka magpapaano po, yung extra virgin olive oil? Yung magpapamix po?
Yes.
Just
Yes.
leave it at the guard set, Father.
I already returned. Ang wala na lang ko dito is yung hindi na ko pinasa ko mo ng benta ng sabon dito sa loob. Somebody else is doing it. Because nakakulong na ako. Senior citizens, nakakulong kami dito. Okay. Yeah. I hope this is what is this. So, yung incoming mga sunod-sunod na seminar is still how to defend oxygen. Especially the property of oxygen, its vulnerability to infection. You really need to shield it. And I think that this seminar that I am giving also helps me a lot to understand better what's oxygen. So we are helping each other. But I found out that oxygen is really very vulnerable to infection, to acid, to anything. That's why we need a shield, and we have found the shield. That is the acid-base balancing is nature's gift. Very, very nice nature gift. Kita nyo kahit mainit lang na tubig, ayos na. The boiled water is really a wonder medicine. We have stopped leukemia like that, with boiled water. Yes, please go ahead.
Father, curious lang ako, Father. How about hemorrhoids, Father? Kaya po ba nasabon yun?
Yes. Okay. It's okay lang. It depends what stage it is. But pag lumabas siya, haplasan mo ng sabon. Then babalik siya sa loob. Pero every time it is out, just wash it with the soap. We had cases already na natulungan. Did I answer your question?
Father, paano po management nun?
Basta lumabas siya, yung hemorrhoids, basta lumabas siya, just hugasan mo lang siya ng sabon. And then, kung bumalik, ganon. Basta lumabas siya, hugasan mo lang siya ng sabon. And then at a certain point, mawawala siya. Ang nakita ko dyan is gaya siya ng yung goiter. Yung goiter sa inom lang nakukuha eh. Pero itong hemorrhoids, we had already cases. Matagal na natutulungan ng sabon.
Okay, Father.
Okay.
Father, there is a question sa messenger, Father.
Yes.
7-year-old boy started to put 3 drops sa water niya. Nag-start yesterday. Normal po ba ang pag-pee ng 3 to 4 times
Okay lang. Okay, 3 drops is okay. To a glass, 200 ml preparation, ha? Basta 200 ml preparation, whether it is milk, water, that 3 drops is very safe. Even
Yes,
for
Father.
babies.
Pero ang normal schedule niya, Father, of peeing is 1 in the morning and 1 in the
It's okay.
the evening.
Anytime she can take it. No problem.
Yes, Father. Thank you po.
It's safe. It's safe. Okay. So I hope helps. Repeat the process of mixing essence with the okay. Yung I just saw it. Okay, asking for the ratio of essence and olive oil. No, okay. I will repeat. So para madali anuhin, if you can take a sample if you like. A 9 tablespoon of olive oil, and then you want to put 1 tablespoon of essence. Mix it. No, you blend it, or you just shake it. No, until it becomes like milk. The color is yellowish. Says 10%. 10%. So 9 tablespoon to 1 tablespoon. Did you get it, Jer? Bob? Okay. Yes, okay, thank you. So I repeat, okay. 9 to 1. No? So it's 10%. And it is used topical application. It's not drinking. It's not for drinking. Although I don't think it will harm if you drink. But it's topical application. Very good for arthritis, insect bites, no? Anything itchy. No? Yan. Even for small wounds. That mixture of what this is. No. Or if you are suffering with very dry skin, that one is good. Will help.
Father, sa mga may bukol, pwede rin.
Yes.
Parang yung sabon na inahaplas.
Yes, pwede siya. Kasi that enzyme is there. In fact, the olive oil is just a vehicle, sasakyan para i-deliver yung enzyme. No? So the olive oil is the vehicle, and I chose olive oil instead of the VCO. VCO has another use. Kasi ang VCO is saturated. Pag malamig, natutulog. Instead, the olive oil, kahit anong lamig, no, in Europe, in winter, no, hindi siya natutulog. So it does not block anything in your system. That's the advantage of the extra virgin olive oil. You can use it for arthritis, small wounds, no? Even yung sa breast cysts, you can use it to deliver oxygen. Okay.
Father,
Yes.
Father, ask ko lang, yung cousin ko merong goiter. Toxic daw po.
Okay. Can try. I already give that seminar here. In fact, I also give that testimony of one who had goiter. He was from Bacolod. His goiter was so big that his eyeballs Yung mata niya halos no, lalabas na sa sakit. Pero nawala yun. It took him about maybe a year or two of taking it. Pero no operation, no operation, no medication.
Hindi pa
Just
rin,
ensign.
hindi pa naman po siya ganun, Father.
Alin?
Yung eyes niya, hindi pa naman po nagkakaganon.
Ah, okay. So the very big chance. Just be constant with it. Be very constant with using the enzyme.
Enzyme din, Father.
Yeah.
Eh, yung sabon po.
Pwede siya haplasan ng sabon sa labas.
Okay,
Very,
sige.
even the olive oil. So can be topical kasi ang importante yun, deliver oxygen into it.
Opo.
So drinking and topical application should help.
Sige, Father. Father, salamat po.
Thank you. Okay. You're welcome. Okay, you're welcome.
Father, how about skin allergies, Father? Pwede po ba yun sa sabon? Yung mga
Sabon,
skin
yes. Sabon, pwede yan sabon. Sa skin allergies, yes. Even sa, but you have to be very perseverant. Even sa psoriasis, we had cases na mitigate yung pain o na yung problema nila sa psoriasis. Sabon din. Now, even maybe the olive oil and the enzyme might also work. Lately lang yun yung yung enzyme tsaka olive oil.
Father,
Pero
how about yung itching po talaga, yung medyo very itchy, tapos I made a solution, yung nilagyan ko ng thumb size na sabon and then yung water. Okay lang po ba yun, Father?
Yes, it should work. It should work. Nakita mo how it healed your yeah.
Doon ko nga pinaturn, Father.
Yes. She did not experience hapdi with that terrible burns, huh? So how is she now? She should be okay now.
Cariel will be giving pictures, Father, yung latest
Yeah, okay.
pictures, Father.
Yeah, in fact, less than 1 month, wala pang keloid.
Yes, Father.
No keloid at all. Okay. Very good. So I hope it is helping. And the upcoming seminar is still how to defend oxygen, how to protect oxygen. No? And the reason how, that's what I'm researching now to, I think there are enough materials at this point already showing up na talagang you can shield your red blood cells. The next thing is I'm trying to find out the properties of oxygen. I think I found already one. The electronegativity of oxygen is very, very high. Kaya susceptible siya talaga sa mga positive charge.
Father,
Yes, please.
sorry, wait. The breathing.
Yes.
How frequent should we do it?
Okay. The practice.
Sorry.
Okay. They practice even 3 times a day, something like that. No. Actually, yung 478. Usually I do it only at night before sleeping.
Okay.
To be able to sleep at once. Fast. You sleep very fast, huh? That 478.
4-7.
4 inhale, hold 7 counts, and then 8 counts to release. And repeat, 4, 7, 8.
Okay, so Father,
helps.
it's 3 times a day.
You can, because it is a breathing exercise to relax against anxiety. So when you find yourself in that situation, you can stop for a moment and do that for 4 or 5 minutes.
Okay.
Yeah.
Thank you. Thank you.
So the same with that centering, that 4-4-4. In fact, yun lang ang dalawang pinalabas ko dito para madali maalala. 4-7-8 against anxiety. 4-4-4 is concentration. To concentrate, to do action. That 4-4-4. Instead, the
What's better?
4-7-8 is to sleep.
Father, what's better? That 478 or 444?
It depends. Kaya nga, kung anong gamit niya. 4-7-8 to relax against anxiety or to go to sleep. Instead, the 4-4-4 is ready to fight. You are centering, you are focusing on something.
Okay, thank you.
So you train the brain to be attentive. Instead, the other one, you train the brain to sleep.
Thank you, Father.
Pero maraming technique, ha? Maraming technique sa sa internet. Okay.
Father,
Yes, please.
the mother of Cariel, Father, wants to thank you, Father.
Ano?
She wants to thank you, though, Father. She's
Okay.
is with in the group, Father.
Yeah, you are welcome. You are welcome. You are welcome. Siya yung napaso. Ang buong kamay, katawan, saka sa, I think also on the legs. No, no. But the worst one was on the right hand and the breast, I think, something like that. In 21 days, she was already hit. But what is more important is the day following that was applied to her, she did not have any hapdi anymore. You know what hapdi ng napaso, ah? Yun lang. Sabon, tinunaw yung sabon at saka spray sa napasok.
Father, may comment po dito sa chat box from
Okay.
Baguio Carmel.
Yes.
Medyo ano lang po, Father, parang thanking you. Deo gracias po, Father.
I saw it, yeah.
Yes, Father. And also to your collaborators.
Okay.
As usual, attending this webinar is worth the time. Really informative po and doable.
Yeah, I saw it flashed for a while, yeah. Thank you, okay. Thank you.
Father, question.
So kay Kuya Carmel Baguio sa mga panalangin. Pag may problema ako, sa kanila ako tumatawag, ipagdasal niyo ako. Carmel Baguio and Carmel Lipa.
Okay. Father, question.
Yes, please.
Ano po may papayo nyo yung sa mga middle age na kunyari barado po yung mga puso ng yung mga arteries nila ng mga ano po
Cholesterol?
Apo.
Yeah.
Anong essence na makakatulong
Okay.
doon?
The hydration with the enzyme. We have prevented many heart operation because of that. I have already given that seminar, and I think I should also then not the names but the cases. Kasi I cannot put the name. I did not have any permission from them.
Okay.
But I mentioned the case. One is from Krami, an officer in Krami. And then another one is the father of one of our Salesians.
Opo.
Joe 4 bypass. No,
Mm.
they were asked to prepare 500,000 to prepare it. In 3 months, nawala yung bara.
Wow. Mm.
Paano next?
Paano po ang ratio nun sa water po?
Water,
Ang-
hydration lang. Hydration lang. Depende sa timbang mo.
Opo. Pero yung essence po, ilang pong patak?
Just that 3 to 5 drops.
At
Basta dehydrated ka, paparusahan ka. You will have high blood. Basta dehydrated ka, high blood ang atake sa'yo.
Oh, opo. Father, 3 drops lang po a day yun.
3 to 5 drops per glass of 200 ml.
200 ml. Opo. Thank you, Father.
Pero ang importante yung volume ng tubig niya in
Opo.
proportion to his weight sa timbang niya.
Opo. Yung turo niyo po.
We give that formula already.
Yung 150, opo. Divided by 2, divided by 30.
Yeah.
Opo.
That formula is very important to know how much water you need.
Liters in liters. Thank you, Father. Thank you very much.
Basta dehydrated ka, you will produce cholesterol. But when you are hydrated, you will not make extra cholesterol. Kaya hindi yung problema yung fats. Hindi problema ang fats na ano na yan ni Lundell, Dwight Lundell. Hindi fats ang problema, hindi cholesterol ang problema. Dehydration.
Dehydration.
Inflammation ng artery.
Opo.
No, that means the muscles are working too hard without lubrication.
Oh.
And at a certain point, you get the cramps. That's cardiovascular
Opo.
problem.
So, Father, yung dehydration leads to inflammation. Opo.
Yes.
Opo.
The inflammation is already a sign your brain is helping your situation. Pero tulungan mo na yan.
Opo. Thank you, Father.
Okay. So inflammation is good. Okay.
Sorry, Father, kaya pala, Father, ako kasi mataas yung cholesterol ko. No matter ang diet ko is super na, pero hindi ako hydrated nung una, hindi siya bumababa yung
Yeah.
cholesterol ko.
Kahit
Nung
anong
na-
diet gawin mo dyan.
Opo. Nung
Basta dehydrated ka, you will lalapot kasi dugo mo eh.
Okay,
Basta
do.
dehydrated ka, lalapot yung dugo mo. Malapot na dugo, hindi makatakbo. So itutulak siya para mag-supply ng oxygen sa heart.
Okay,
That's
Father.
hypertension.
Opo.
That's okay.
Actually, yun nga, malaking, tapos nag-start ako mag-essence at saka hydration talaga. As in 1.5 to 2 liters a day. Ayun, hindi ako nag-meds ng cholesterol. Bumaba naman yung cholesterol ko, Father.
Yes.
Kaya ang
Hindi,
ganda.
you will not, the body will not make extra cholesterol. We need cholesterol. The brain needs cholesterol. But your body will not make extra cholesterol if you are hydrated. But if you are dehydrated, talaga gawa siya extra cholesterol to protect the arteries.
Ayun pala, Father. Magandang kaalaman yan, Father. Thank you, Father.
I repeat that because when you are hydrated, your body will not make extra cholesterol. The body will need cholesterol, will make cholesterol because the brain is the most user of cholesterol. No? But the body will not make extra cholesterol if you are hydrated. But the moment you are dehydrated, uunahin niya talaga, bibigyan kanya ng cholesterol to protect the arteries. Hindi yan sabihin ng ano.
Actually,
Pero-
Father, meron
Pero
nga akong
pinalabas na yan ni Lundell, ha? Lundell already, Dwight Lundell, pinalabas niya kung anong dahilan ng cardiovascular problems.
Opo, Father. Kaya pala nagtataka din kami, Father, before kasi ang tingin nila kapag mataba ka, if you're overweight, automatic mataas ang cholesterol. Pero nung meron akong uncle, talagang overweight siya, pero ang baba ng cholesterol niya, yung pala, he drinks a lot of water. Talagang ano siya, maliquid siya.
Yes.
Maliquid.
Basta hydrated ka, you will not make extra cholesterol. But the body will necessarily make cholesterol because the brain needs it. The fattest organ in the body is the brain. And the body, that's why some drugs is very dangerous. They control the making of the cholesterol and they cannot supply cholesterol to the brain. Ibang sakit naman yon. So it's important to know the drugs or the medicine you're taking for high blood. Anong ginagawa niya? Anong tinitira niya? Kasi may ano yan eh. May tinitira sila sa liver. Now, if ang tinitira nila is essential function ng body to help the brain, then you have to think about it.
Yung ibang doctor, Father, hindi na i-explain ng mabuti yung ganyan eh.
No, they will not.
Opo, nagbibigay lang sila ng maintenance mo, ganito, ganyan.
Hindi.
Tapos wala explain kung
There is another. Okay.
actually,
There is another.
Opo, Father. Ang daming klase ng maintenance, di ba, Father? Pero hindi nila in-explain mabuti kung ano ba yung para sa'yo, bakit, ano yung difference nito sa ganito. Minsan nagtatanungan kami, ano maintenance mo? Losartan. Yung isa, Candesartan. Yung isa, ganito. Parang, anong pagkakaiba nila? Hindi in-explain yung doctor.
Mayroon pa isang problema dyan. Yang they try to balance your to check your BP by adjusting the medicine, but they will not tell you about hydration. Very dangerous. Dapat una stabilize mo ang hydration mo. Pag hindi, siso yan. Siso yan sa gamot.
Oh, okay, Father.
So, ang unang i-attend nyo, basta high blood ang problem, anong timbang niya, anong kailangan niya na tubig, yun ang asikasuhin nyo muna talaga, ang hydration niya. Kasi pag i-balance lang nila sa gamot, delikado, very delikado. Hindi mo mabalanse sa gamot pag hindi mo in-address ang hydration.
Okay, Father. Now we know. Thank you, Father.
Okay.
Kariel.
Yes, please. I still have 5 minutes. Then magdasal na kami. I still have 5 minutes. Okay. Anything more? Okay, so next time naman, okay. I think my next thing is blood pH. Blood pH and then the properties of oxygen, the electronegativity of oxygen.
Father, pwede po magpahabol?
Yes, please, go ahead.
Opo. Father, yung pong tapos ng nagkatarak surgery, both eyes, pwede po bang instead doon sa binibigay ng ophthalmologist na ipapatak na maintenance sa mata, pwede po bang yung water with essence na lang po?
Okay, kung may sundin nyo muna yung doktor. Pero there is no harm. Okay. Sa 200 ml, you can put only even 3 drops. You can spray it.
Okay, Father. So magpapatak pa rin po nung reseta
You
ng
just,
doktor.
kung anong prescribe ng doktor, I cannot go against it. But to heal the wounds in the operation, nothing better than oxygen.
So okay lang po, Father, na gagamitin din yung patak sa mata, then mag-i-spray din nung
Yes,
once in a
yes.
while nung 200 ml may 3 patak na essence.
Yes, you can spray it.
in
That's
both
very
eyes.
safe.
How many times a day po, Father?
Every time na may itchiness siya, pag kumakati.
Okay po, Father. Then another one, Father, yung 78 years old po, my mother, 78 years old. Yung ano po yung ilang patak po yung maganda po na regular niya ipapatak sa glass of water.
Anong timbang niya? Hindi yung patak ang importante.
It's about siguro mga 50 kilos.
About 110. At least, lagay mo sa at least 2 liters. Mga 1.5 yan ata o 1.7. Pero huwag siya bumaba sa 1.5 liters. Kung maabot niyang 2 liters, very safe.
Opo, may maintenance din po siya. Mhm.
High blood?
Hindi po, Father, yung sa ano po noon, yung sa heart niya. Pero 2 na lang po ngayon yung iniinom niya. Dati 4 po. Ngayon 2 na lang. With the help
Ayusin yung hydration
Essence
muna.
din. Oo.
Pag hindi nyo inayos yung hydration, bibili lang kayo ng bili ng gamot. Ayusin nyo hydration, then the medicine can help. Pero kung asahan nyo lang ang medicine without hydration, hindi yan tatrabaho, hindi yan gagana.
Yes, Father. May share lang pala po ako, Father, kasi may years na rin po na nag-share ako netong to my yung teacher ng anak ko nung grade 6 teacher. She's now a survivor of ovarian cancer because of that enzyme essence na iniinom din niya. Balik na siya ngayon sa pagsiserve sa simbahan. Stage 4 siya noon po, Father, stage 4 ovarian cancer, tapos she's a survivor now. Aside from taking the medicine yung binibigay ng doktor, talagang regular na rin po siya nag-essence.
Okay. Yeah, ang hydration nyo, asikasuhin nyo talaga. Pag hindi yan ang na-address, parusahan kayo sa gamot. There was a thing from Carmel. I could not read them all. Chewable, ano yun?
Good evening po.
Good evening.
Ito po yung sa Baguio Carmel.
Yeah, pakibasa nga.
Father, what can you say about the intake of chewable vitamins that no longer require water?
I don't believe that. Well, you must know your weight and no. Be careful. Be careful with those.
Magpapataka talaga kayo itong sa ito. Tapos, pwede siya
I don't know how they work, but without hydration, I don't know how your medicine will work.
Sa mother na. Sa bagay, duwa naman lang bagang niya, maintenance. Tubig talaga, ang hydration talaga, ang sa heart din.
Yeah, I doubt very much kung maybe for a while, but it will not cure you.
Ano lang siya,
ano siya, yung palliative. Palliative, hindi siya cure. Okay?
Yes, Father.
So, yeah, I think that was the question from Baguio. It's a palliative approach, but it's not a long-term cure. It might address the moment, but it is not going to cure without water, without hydration. Okay, so I have to go. See you.